Bismillah ar-Rahman ar-Rahim. Our lecture today is Mandibular Major Connector. Number 1, we have Lingual Bar. Today we will talk about Mandibular Major Connector types. First of all, Lingual Bar, which is the most widely used major connector for mandibular arch. It is a half pear in shape. As we know, pear يعني كمثرى عرموطة. شكل البار in cross section half pear, tapered superiorly with the greatest bulk inferiorly, and of course all edges should be round, no sharp edges. قلنا ماكو بالبيشنت ماوث لا sharp edges ولا hard peripheries. ما نريد نسوي أي abuse للتشيو. Everything in patient mouth should be with round ended. For mandibular arch we have tongue, we have floor of the mouth, movable tissue in the floor of the mouth. So the mandibular major connector, any type, any one of them, should be free of the movable tissue. من الtongue يتحرك patient mouth, patient من يحكي من ياكل. المajor connector should be free of the movable tissue. يعني لا البوردر مال المajor connector تضغط على floor of the mouth ولا تتعارض ويا حركة الtongue. So, the major connector should be designed, each type, to be free of movable gingival tissue superiorly and free of moving floor of the mouth. ما يتعارض ويا حركة الtongue. We have a limited space in this area. We have lingual frenum inferiorly and tongue movement inferiorly. And we have gingival tissue superiorly. So, for lingual bar, we need space at least 8 mm or more to design the lingual bar. Otherwise, if we don't have this much space, we have to take or decide another type of major connector. As we said, it's the most frequently used mandibular major connector, the lingual bar, because of its simplicity in design and construction. It design simple, فيعتبر the most widely used. It should be used for all tooth supported removable partial denture, all tooth supported removable partial denture, unless there is insufficient space between marginal gingiva and the floor of the mouth. أي case تكون tooth supported يعني class 3, we should use lingual bar unless إنه ما عندنا space enough بين marginal gingiva and the floor of the mouth. So we have to pick another type of major connector. طبعا من ضمن المميزات major connector should not impinge on the tissue. ما نريد نضغط، احنا عندنا movable tissue lower arch، ما نريد ينحشر، ما نريد ينضغط by the major connector. So we have to do some relief under the major connector for mandibular arches. لازم نسوي kind of relief حتى ما نضغط أو نحشر التشيو بالنسبة للlower arch. We have two types to measure the height of the floor of the mouth clinically. we either take a periodontal probe. Periodontal probe have measurements بيها طول معين وبيها تحديدات بالطول مالتها، فنجي نقيس length from the gingival margin of the teeth to the elevated floor of the mouth. يعني ال patient should pick up his tongue and lick his lips، انه يطخ ال upper vermilion of the lip، الحافة مال اللب يطخها بلسانه. بهاي الحركة احنا نقيس ال length بين ال gingival margin of the lower teeth with the elevated floor of the mouth by a periodontal probe. This is the first measurement method. Another method to measure the height, we take an impression with the tongue is elevated. Take an alginate impression with the tongue elevated and then pour the impression to have a cast, and on the cast we measure the length and then decide which type of major connector we have to do. Number 2 of mandibular major connector, lingual plate or lingual plate. Basically, lingual plate considered of a half pear-shaped lingual bar with a thin solid metal projection extend from its superior border onto the lingual surface of the teeth, presents a scalloped appearance. يعني lingual bar نفس lingual bar which is a half pear shape with an extending projection of metal strap. metal piece تمتد من هذا lingual bar تغطينا lingual surface of the teeth with a scalloped appearance. تجي شون الجنجفة ويا ال scalloping of the teeth. طبعا ال lingual plate should be positioned as low as possible in the floor of the mouth but not interfering with the functional movement of the tongue and soft tissue. مثل ما قلنا أي major connector should not interfere with the functional movement of the tongue أو interfering with the soft tissue. The superior border of the lingual plate contoured intimately contact the lingual surface of the teeth above the cingula. تمتد هاي lingual plate تغطينا السنجلم of the teeth with an intimate contact. هذا ال intimate contact راح يسوي لنا seal, prevent the food from trapped under this major connector, وهذا ال intimate contact راح will add to the stabilization and retention and adaptation of the major connector. راح تنمد أكثر، راح يزيد السبورت مالتها، وراح تكون stable أكثر وريجد أكثر. مثل ما قلنا الميجر كونكتر كل ما يكون thin كل ما الريجيديتي مالته أقل، كل ما زايد الثيكنس أو الاكستنشن مالته كل ما الريجيديتي والسبورت مالته يكون أحسن. فالlingual plate it's a lingual bar with a metal projection covering the cingulum of the teeth with an intimate contact giving a scalloped appearance. زين. An indication of the lingual plate. Space lingually is not enough like in case of high frenum attachment. Space is not enough for mandibular major connector. فش نسوي؟ نحط lingual plate لأن أكو high frenum attachment نمدها على السنجلم of the teeth. When there is excessive vertical resorption like in class 1 situation. Class 1 bilateral free end extension with a severe resorption, a lingual plate will add to the adaptation and support of the major connector in these cases. In case of periodontally weak anterior teeth من عندنا teeth have a problem periodontally معناها أكو mobility in these teeth. To stabilize these teeth by covering the lingual part of them and stabilize them by the lingual plate. Lingual plate is indicated. And in the presence of tori, a torus mainly will be in the floor of the mouth. So we don't have such space for mandibular lingual bar. نستعمل lingual plates and it will be extended to the cingulum of the teeth. Contraindication of this major connector in case of poor oral hygiene. Patient have a calculus, have bad oral hygiene. احنا راح نجي نغطي اصلا معظم السن، فمعناها الاسنان اللي راح تتغطى بالميجر كونكتر واللثة should be healthy، لان احنا اصلا راح نجي نغطيهم، ف it should be healthy and no crowding. الكراودنج هسه مثل ما نشوف بالصورة will prevent الادابتيشن of the major connector of lingual plate. ما راح نجي نمد lingual plate واحنا عندنا crowding بالanterior teeth، ف it's contraindicated in these cases. In case of spaced teeth مثل ما نشوف بالصورة، إذا استعملنا lingual plate الطبيعية العادية بهاي الحالة إنه السبيس بيها التيث بيها spacing، راح يبين المثل وراح يصير كل الشكل objectionable. فنسوي modification. الموديفيكيشن مثل ما نشوف إنه lingual plate تنمد على كل سن واحدة for each individual tooth. المثل will be extend to each individual tooth to the contact area and then turn down apically. This is called interrupted lingual plate أو step backs. Number 3 mandibular major connector double bar أو lingual bar with cingulum bar or Kennedy bar. Double bar consists of lingual bar with another bar rest above the cingula of anterior teeth, leaving lingual surface of the teeth and the interproximal soft tissue exposed. We have two bars in this type of major connector. Lingual bar as low as possible without interfering the floor of the mouth, and another bar rests on the cingulum of the anterior teeth. They are joined together at the end by a minor connector. At each end joined by a minor connector, and the rest should be placed at each end of the upper bar. Indicated when their lingual plate indicated but the anterior teeth have an axial alignment, require excessive blockout of interproximal area. يعني anterior teeth aligned in a way, if we do a lingual plate we need excessive blockout of interproximal area. There are spaces interproximally between the teeth, need excessive blockout, so we use double bar. In presence of wide diastema or spaced anterior teeth that result in the lingual plate or other mandibular connector will be shown through the spaces, we can use double bar. Disadvantage of this bar, it it has a tendency to drop debris, especially with the crowded anterior teeth, because its tooth bars connected at the ends with a minor connector and rests. It have a tendency to trap debris and food. Number 2, double lingual bar may be objectionable to the patient, irritate the tongue, and annoy the patient due to multiple borders and thickness of upper bar. قلنا كل ما design simple كل ما it's comfortable to the patient. This type not considered as a simple because it combines two types of bars. Number 4, labial bar. From its name, it will cross the mucosa on the facial surface of the mandibular arch. راح ينمد على labial أو buccal vestibule for mandibular arch. It's a half pear in shape like other major connector in cross section, but because its placement on the external curvature of the mandible هيكون أطول, longer than any corresponding major connector, longer than the mandibular bar or mandibular plate أو lingual plate العفو lingual bar أو lingual plate. To ensure rigidity, height and thickness of labial bar must be greater than those described for lingual bar. The indication for this type of major connector we have in case of extreme lingual inclination of remaining lower premolar and incisor prevent the use of lingual bar major connector. The teeth will be inclined lingually. من حيكون بيها inclination lingually, it will be difficult to place the plate lingual plate أو lingual bar, so we use labial bar. In case of large mandibular tori that cannot be removed, مثل ما قلناكو cases or patients that are compromised cannot go through surgical treatments and have a tori, we can use this type of major connector. Number 3, severe abrupt lingual tissue undercut that make it impractical to use lingual bar or lingual plate major connector. من يصير عندنا severe undercut lingually that will prevent the use of another type of major connector, we can use lingual or labial bar. Modification for labial bar in which it can be used in association with lingual plates as a swing lock design. مثل ما نشوف بالصورة هذا السوينج لوك ديزاين انه نقدر نسده ونفتحه بلوك يصير بمثل قفل ومفتاح من صفحة. اللينجوالي تكون lingual plate واللابيالي labial or buccal bar connected lingual plate major connector by a hinge at one end and a latch at the other end. من صفحة يكون بهنج شلون الرزة مال الباب شلون الباب نفتحه والother end هيكون بيها lock راح ينقفل ويا الميجر connector. Number 5 we have sublingual bar. sublingual من اسمه هيكون مستواه inferiorly to the lingual plate or lingual bar when the height of the floor of the mouth is less than 6 mm, which is not enough to place lingual bar or any other type of major connector. And it's contraindicated when we have tori, we have high lingual frenum or interfere with the elevated floor of the mouth. We have another type which is called cingulum or continuous bar. It's only a cingulum bar. مو مثل الكندي or double bar. الدبل bar we have lingual bar with a cingulum bar. Now we have this type, which is called cingulum or continuous bar. It's only a bar will extend on the cingulum of the teeth, indicated when excessive blockout of interproximal area of anterior teeth is required. As we see, run in the cingulum area with a scalloped appearance, and it's contraindicated when anterior teeth are severely tilted lingually or there is wide diastema or spacing, contraindicated the use of this bar. As we see here, the types of major connector, we will start from the left, lingual bar, then lingual plate, double bar or Kennedy bar, which is a lingual bar with a cingulum bar, then cingulum bar, then sublingual bar. Briefly, a major connector for mandibular arch should be free of movable tissue, not interfering with the tongue movement, and should be away from gingival margin of the teeth. Thank you.